And there are multiple challenges in considerations for treatment for VOD SOS. The most important include early intervention, so that one is giving the patient the very best chance of recovery promptly. And another major challenge is how long do you treat for? What's the duration of therapy that's optimal with Defibrotide for VOD SOS? And so today at the meeting we presented our pooled analysis of the largest experience to date of time to complete remission and the duration of therapy needed to achieve that. And we looked at two studies, our pivotal phase 2 trial and our actual approval finding phase 3 study. And we looked at actually 102 patients from the phase 3 and then 75 patients from the phase 2, from the 25 milligram per kilo arm of that phase 2 study. And that actually gave us a total of about 177 patients in an analysis that 176 patients to be precise, that gave us that analysis that we could look at that time frame in those patients. And then in the treatment IND, we had a remarkably high number. We had 1,000 patients that we could evaluate because we used as a surrogate there of time to discontinuation of treatment upon achieving complete response. And that was a surrogate for CR because the treatment IND was an expanded access program, so it didn't have the same rigorous data collection that we did for the phase 3 and phase 2 studies. The other point with the treatment IND is that they were a population all undergoing transplant, but they also did not include patients who had multi-organ dysfunction or multi-organ failure, so a slightly less sick population. What we saw, which is I think very interesting, was that the median time to achieving complete response over the whole group in terms of duration of Defibrotide therapy was 24 days. So that was what the median time to CR was established at. The range was quite broad, 7 to, in fact, the longest patient treated was over 120 days. But that single patient was truly an outlier. The important message was that at least 3 weeks of therapy appeared to be the median time to achieve complete remission. What was really interesting, though, is that whilst half the patients needed about 3 weeks, up to 40% of the patients needed 4 weeks. And that was an important message because what it told us was that you treat, but not not in a way that's parsimonious. You must make sure that there is an adequate duration of therapy. And in the treatment IND, the number of patients needing 4 weeks of therapy to achieve CR was lower than we saw by percentage than we saw in the phase 2 and 3. And that's probably because in the phase 2-3 study, they were a sicker population. So I think putting it all together, I think that the message from the analysis was treatment to CR on average 24 days worth of therapy. Makes complete sense from what we know from our treatment durations. What was an important takeaway was, though, don't stop treatment too soon. Keep treating until you achieve your complete remission, and that can take up to 4 weeks. And whilst at the same time, that's obviously a challenge, it's a very good challenge, if you will, because obviously we know that for severe VOD SOS, the mortality is in excess of 80%. So, really one has to take the consideration of treatment in these patients very seriously.